A lifetime of chronic pain from scoliosis and arthritis forced Michael SATOK WOLMAN to abandon brush and canvas for mouse and laptop. But he couldn't let go of the opioids he'd come to depend on, regularly finishing off his prescriptions prematurely.
I would have to go to the physician and make my case and explain why I needed more medicine than he was prescribing.
SATOK WOLMAN topped up the fentanyl with heavy doses of ibuprofen, which ate through the wall of his stomach, causing it to burst. When he was admitted to the hospital last spring, he was on 5 times the recommended dose of opioids.
I had to come to grips with the fact that I was an addict and that I had been an addict for over 30 years.
Today, SATOK WOLMAN learns to manage the pain without painkillers at this hospital clinic, a model other jurisdictions are trying to adopt. It's for patients who've had surgery here, a population that often doesn't get adequate follow-up, despite being most at risk of abusing painkillers.
Well, for us, 70% of the patients we see have a chronic pain problem before surgery. And so they're already on high levels of opioid medication even before they've had the surgery. After surgery, it's going to be higher, and we want to give them all of the options for managing that pain.
Are you doing okay, Tom?
The alternatives to opioids include a combination of physiotherapy, meditation techniques, acupuncture, and counseling.
There we go.
The head of the clinic teaches patients to separate pain relief from long-term dependency on painkillers.
If you're telling me your pain today is 9 out of 10, and your pain was 9 out of 10 25 years ago, you're now on doses that potentially aren't helping you anymore, the effectiveness is gone, let's start looking at solutions and how we move forward. And Michael was strong enough to say, okay, yeah, I have an issue here, let me try something different, and now has been able to change his course.
SATOK WOLMAN is now prescribed Suboxone to treat his addiction symptoms. It also comes with a risk of dependency, but he's now managing his pain on his own. Vic Adopia, CBC News, Toronto.